So quickly look on another category of drugs, and these ones are like drugs that act on opioid receptors. Okay, of course we define them, we look at the various categories that fall under this. So after the categories, we also look at what different examples of drugs that fall under each of the categories. Drugs acting on opioid receptors. So these are different opioid receptors. Okay, so we said that what drugs acting on opioids could be what drugs that are triggering the opioid receptor, that's opioid agonist, and also drugs that are what calming down or blocking the opioid receptors. That's basically what is known as what the antagonist. Do you understand? So let's look at them. First of all, look at the different types of opioid receptors. We spoke about this when we were talking about introduction to pharmacology, right? So examples of opioid receptors, we have the mu receptors, we have the kappa receptors, we have the delta receptors. So they are mainly found in the brain, they are found in the genital area, the spinal cord, they are found in the gastrointestinal tract. So they usually modulate how much pain you feel, they modulate how well you feel about yourself. You do something and you are so a fan of yourself, okay, and also autonomic function. So for these opioid receptors, the opioid drugs, now we're talking about the drugs now that are basically what they trigger the opioid receptors. So we have drugs like the morphine, we have the codeine. Okay, this is morphine. Okay, do you have a picture of codeine here? No. Okay, we'll talk about it, don't worry. We have other ones like what heroin, we have the Oxycodone, we have the Hydrocodone, So synthetic ones now, these are semi-synthetic. Synthetic ones, let's look at it. Okay, no, I didn't actually capture that. Synthetic ones, we have drugs like the fentanyl, we have the methadone, we have the tramadol. So this is fentanyl. Okay, so action generally, they activate what these opioid receptors, the mu receptors, so they relieve you of pain, they'll make you feel as if nothing is happening. Okay, that's why people abuse them. The next we have the partial agonists. These are the full agonists. We have the partial agonists that will just partially trigger it. We have drugs like the buprenorphine. Okay, we have the what pentazocine, and we have the what nalbuphine. So they activate receptors just partially, so they relieve pain, opioid dependence treatment too. So sometimes if you have been taking some other opioids and you are withdrawing and having some issues, you can take this. So next we have the antagonist. Antagonists will what block it. So examples is naloxone. So naloxone have the naltrexone. So these ones, they block the receptors rather. So any effect that the receptors were having, they block them. So naloxone, okay, naltrexone, and all of that. So this is just a preamble, this is just an introduction to the whole concept. We'll come back and revisit the pharmacology of each of these drugs.